first.
Hello, it's Dr. Nusrat Chowdhury from Bangladesh. I'm a PhD candidate of AUSN, and I'm presenting about international comparisons of roles and responsibilities of healthcare professionals in palliative care. Responsibility. Whether that occurs at home or in hospital, there is a period during which healthcare professionals can have multiple opportunities to help the soon to be bereaved. It's the responsibility of healthcare professionals not only to help you die peacefully, but also to live until you die. This palliative care. Palliative care refers to the optimization of quality of life for both the patient with serious illness and their families, using special measures to anticipate, treat, and prevent suffering. This care encompasses the continuum of illness, including physical, psychological, emotional, spiritual needs of seriously ill patients. Healthcare professionals have many responsibilities in end-of-life care, which will range from having a sensitive conversation with an individual about their care and preferences, recognizing any changes in condition and offering compassion and support to the patient and those important to them. This will require a broad range of skills and awareness of values which underpin this behavior. Different countries around the world is following different palliative care guidelines and models for healthcare professionals. This paper gives an overview of selected guidelines and current practice which could be helpful to ensure proper maintenance of responsibilities of healthcare professionals as well as effective palliative care. Here's an introduction about palliative care, which affirms life and regards dying as a normal process. Since it is a natural process, it is wise neither to hasten nor to postpone death. Therefore, treatment should integrate the psychological and spiritual aspects of patient care. Palliative care calls for a support system to help patients live the rest of their life as actively as possible and for the family members who need to develop coping skills and go through their own bereavement. To achieve these goals, a multidisciplinary approach is essential. According to WHO, the term healthcare professional covers a wide range of professions, including doctors, nurses, physiotherapists, pharmacists, and nutritionists. There are many people who provide palliative care services. Some specialize in palliative care as a full-time role, and others will have palliative care as part of their work. Both different healthcare professionals in palliative care. General practitioner, GP play a role in providing palliative care as they are the closest to community and easiest to access. In addition, home visits are also possible of GPs when compared to other doctors who are encouraged with their work. GPs can build up a close rapport with the patient and family, since most of the patients know their family doctors for years and they are aware of the background of these patients and know the resources available for them.
Please tell the people when the next slide is. Okay. Next slide. Because of the Skype, they can't see you. Just say that.
Next slide is responsibilities of healthcare professionals. Palliative care aims to improve the quality of life of people with life-limiting conditions and their families, not only by treating their physical symptoms, but also by attending to their psychological, social, and spiritual needs. Palliative care is applicable for people of any age and may be integrated at any point in the disease trajectory from diagnosis through the continuum of care bereavement. professional, you should understand the significance of the physical, psychological, social, and spiritual issues that affect people with life-limiting conditions and their families throughout the continuum of care. Demonstrate the ability to use the palliative care approach as early as possible as is appropriate in order to facilitate person-centered practice that recognizes the concerns, goals, beliefs, and culture of the person and his or her family. Provide empathetic care to individuals with life-limiting conditions and their families with clear regard to the individuality of each person. As a healthcare professional, you should show a commitment to one's own continued professional development and learning and facilitate the learning and development of others in order to improve care for those with life-limiting conditions and their families. Show a commitment to developing self-care strategies and to attending to any impact that working with people facing life-limiting conditions and their families may have on you. As a healthcare professional, you should demonstrate the ability to communicate effectively with individuals and families from diverse cultures and different backgrounds. Using professional interpreters which necessary and/or assistive communication technology where necessary. So you should be able to modify your own communication style to facilitate communication with individuals with a range of communication impairments or seek facilitation in this area is required. You should understand the importance of using strategies that empower effective communication. For example, active listening, plain language, appropriate tone, clarifying statements, inviting questions. You should demonstrate an ability to be attentive to the person through careful listening to help the person and the family feel they have been heard. Support individuals or parents in the case of children and minors to make informed decisions regarding the level of information they wish to receive and want to share with their family. You should act as an advocate for the person and their family to ensure appropriate and timely palliative care intervention. Next slide is professional and ethical practice in the context of palliative care. The goal of healthcare is to help people sustain health that is essential to their well-being. However, there comes a time when specific treatments or interventions may be futile or overly burdensome. Integrity in palliative care practice refers to the importance of respecting the person's values, needs, and wishes in the context of life-limiting conditions. It guides all healthcare professionals to reflect on the relationship between their contribution to a person's care and the necessary contributions of other professionals. Professional and ethical practices are about considering how best to provide continuing and integrated care to people as their healthcare needs change in the course of life-limiting conditions. Here's other recommendations from several references. As a healthcare professional, you should work within your current code of professional conduct and engage ethically, knowledgeably, and respectfully with other disciplines. Recognize and respect your professional responsibility to care for people with life-limiting conditions and their families to ensure their comfort and dignity. In the context of your current professional role, establish collegial partnerships and in the context of palliative care, contribute to the professional development of students, peers, colleagues, and others through consultation, education, leadership, mentorship, and coaching. Can you think of other responsibilities? Any responses?
What other responsibilities do healthcare professionals have if you're caring for somebody? Dr. Chowdhury.
Well, you have a responsibility to several things. One is that your standard of care is good. Yeah, you have a responsibility to several things really. One, that the standard of care is good and improving all the time. So you're not stuck somewhere in the past. And then you have ethical responsibilities to ensure that the dignity of the patient and the family are respected. Then you have responsibility, obviously, to the institution you're working for. So responsibilities are also multiple in any healthcare role. But the most important thing is that you're giving the best standard of care that is available to the patient. And there is in palliative care there is a sort of multidimensional and multidisciplinary care provision.
Thank you.
Thank you. Any response, Nusrat? You have other comments as well?
Yeah.
Any response to Nusrat's comments? Do you agree?
Yes, I completely agree with him. The standard is the main thing.
Yeah.
You have to maintain while treating the patient soon to be buried.
Yeah.
Thanks.
Okay. Mina, you have a comment? You said, please go ahead.
Yes, thank you for the talk. And one question was about to me, what were the differences or barriers or facilitators that you would like to make a distinction between 2 or 3 different guidelines that you mentioned in your references, so that I'm still quite unclear. What are the differences or the comparative similarities between those two? That's my first comment. So I would elaborate on those. And the second one was a suggestion that probably you should look into the boundary work, where the professional boundaries are made. And there was a systematic review that came out on professional boundaries in healthcare in a journal. I think it was health policy a couple of years ago. But as far as something like that, that would be something for you to look at, which is quite a clear systematic review on facilitators and barriers of healthcare and professional boundaries in medicine. So that's my suggestion. And the first one was, it's not coming out clear the distinctions that need to be brought to surface in the work. That's all. Thank you.
Thank you so much for your suggestions, valuable suggestions. Thanks. And
Go to the next slide.
I'm going to the next slide, and it's about other healthcare professional issues, some other solutions. Use the resources available fairly in the context of providing appropriate care to the patient with a life-limiting condition. In the context of professional scope of practice and/or role, anticipate and demonstrate the ability to address potential ethical issues that may be encountered when caring for the person with a life-limiting condition and his or her family, such as do not attend resuscitation orders, withdrawal and withholding of treatment, use of artificial hydration and cooling, palliative sedation, and request for euthanasia. Be able to establish and respect patients' wishes about their care and options preferences. I'm going to the next slide. Ethical guidelines for palliative treatment. The attention paid to clinical ethics over the last 4 decades has resulted in some well-established ethical standards and guidelines in some countries. The following are examples of standards and guidelines that are used by Ethics Committee, extracted from Weber 2015. Physicians have the responsibility to inform the patient or surrogate of the diagnosis and purposes, to determine which treatment should be recommended or offered based on available evidence and the patient's clinical condition, and to inform the patient or surrogate the potential benefits and burdens of different courses of treatment. The next slide is as a continuation. Like patients or surrogates have the responsibility to accept or decline recommended or offered treatment based on patient's values and beliefs. Except in limited circumstances, clinicians have a responsibility to accept the decision on the part of an informed adult patient or appropriate surrogate decision maker to decline unwanted treatment regardless of the nature of the treatment and regardless of the benefit of the treatment is expected to provide. Patients or surrogates should not receive treatment intervention that physicians have just medically non-beneficial even if they strongly desire that these efforts can be made. A conscious adult patient should be considered to have decision-making capacity until it is determined otherwise. The surrogate for incapacitated adult can be individual with power of attorney for healthcare, a court-appointed guardian, or the next of kin. The surrogate for previously competent patients should use this substitute judgment principle when possible. That would be the patient say, if the patient could speak for herself at this point. When parents withhold consent for treatment of for minor children, healthcare providers should seek legal authorities authorization to treat without parental consent only in those cases where the absence of the specific proposed treatment is likely to result in unnecessary and serious harm to the child. A patient's treatment directives in an advance directive are often very helpful in clarifying what the patient would find acceptable treatment. Next slide is about recommendations from the Institute of Medicine, United States, approaching death. People with advanced potentially and those close to them should be able to expect and receive reliable, skillful and supportive care. Physicians, nurses, social workers and other health professionals must commit themselves to improving care for dying patients and to use existing knowledge effectively to prevent and relieve pain and other symptoms. Educators and other health professionals should initiate changes in undergraduate, graduate, and continuing education to ensure the practitioners have the attitude, knowledge, and skills to care well for dying patients. Because many deficiencies in care stem from system problems, policymakers, practitioners, organizations, and researchers to strengthen methods for measuring the quality of life and other outcomes of care for dying patients and those close to them. Develop better tools and strategies for improving the quality of care and holding healthcare organizations accountable for care at the end of the life. Revise mechanisms for nursing care so that they encourage rather than impede group end of care, sustain rather than frustrate coordinate systems of excellent care. Reform drug prescription laws, burdensome regulations, and state medical board policies and practices that impair effective use of opioids to relieve pain and suffering. Palliative care should become, if not a medical specifically, at least a defined area of expertise, education, and research. The nation's research establishment should define and implement priorities for strengthening the knowledge base for the end-of-life care. A continuing public discussion is essential to develop a better understanding of the modern experience of dying, the options available to patients and families, and the obligations of communities to those approaching death. I have some questions for discussion. How ready are families to talk about their own experiences of palliative care? Should I continue?
Yeah.
Or,
Repeat the question.
should carers answer the burials of the patients they looked after? How to measure the quality of life of the patient? Who should decide the measures of quality of life? How can I approach asking patients and families about disclosure in a culture that may not disclose terminal cancer to the patient? It is necessary to break the bad news to persons who would like palliative care, but who would not want to hear the word cancer. How can we determine benefits and harmful to the patient, to the family?
Maybe families could in most strong cultures, they have a long experience of some sort of care for end of life. And they always don't have the modern institutional systems. So I think most families are, but I think what has happened is when families have become disjointed from their cultures, and that's where the palliative care often, or the end of life sort of comes as a bit of a shock to them, and the healthcare professionals are partly treating the family as much as the patient. Should carers attend the funerals of the patients they look after? It's an individual choice really. I don't think there is I can say it as a routine. Because much of the carers would be, they'd be going to funerals most when they during their work time, and they have many other things to do. It stretches the whole institution. How to measure quality of life of a patient? The parameters are things like such as pain and ability to talk and ability to meet family, but there's also subjective content from the patient themselves, what they see as quality of life in their care. Often they're quite depressed, and that's quite a challenge, and to address that. And if you can address that, then I think that the quality of life is something supported by themselves and their family or the institutions. Who should decide the measure of quality of life? I think it's very much, I would say it has to be by the patient more than by the healthcare professionals. How can I approach asking patients and families about disclosure in a culture that may not disclose? This is always a challenge in a country like the UK. They often provide the cultural barriers and they will tell the patient. But in other countries there are these problems and it's not something that I'm quite familiar with how they deal with it. Is it necessary to break the bad news to persons who would like palliative but do not want to hear the word cancer? I think cancer has sort of become quite a word associated with evil in the minds of many people. It can be presented in a different way, and that would make it easier. So you don't have to use the word cancer. You can, in other cultures, you can use other words. How can we determine benefits and harms to the patient, to the family? And let's say you have to talk to the patient and the family and regular meetings with them and what they feel are the benefits of the care and provisions that the institution is providing.
Thank you so much for that.
Your response? What about Bangladesh?
Yeah, I'm trying to interview to know about Bangladeshi perspective. And I also want to provide some guidelines about how to break bad news.
Yeah.
And also, I want to explore the current practices of palliative care in 5 countries: Bangladesh, US, Thailand, Japan, also UK.
But what's your impression now about Bangladesh? Do you think the same issues occur?
Yes, this issue. Yes, we are facing problems with this issue because cancer is very common and cancer patients are very vulnerable to emotionally. So, we need to approach them slowly and effectively.
Yeah.
To break the bad news, so that could be beneficial, not harmful for the patient.
Yeah.
Especially for psychology. We need to provide emotional support.
Thank you. Other comments or questions?
Other questions?
Please come to the front so I can explain. Please stand next to Nusrat so you can look through.
In Nusrat, in your study, what was your target? Actually, what is your target? And what are the means how you will measure the quality of life between in the aspect of Bangladesh and the world?
Yes, I'm comparing. I'm working on international comparisons so among 5 countries, so that I can know the current practice of current ethical practice. I'm looking for a biological perspective.
The global perspectives, you have targeted 5 countries.
Yes, 5
And,
countries.
in the
I'm going to
Bangladesh,
explore the current practice so that I can provide guidelines.
and it was in concern of Bangladesh.
Yes, of course.
Where? In Bangladesh, where?
Yes, my target population is
Target.
mainly cancer
Cancer.
patients suffering from cancer.
Okay, do we have other comments or questions? Yes, hi, Sukran. Go ahead.
Yes, I want to say thank you for sharing presentation. But there is sound. No, okay. information. I know that there are different models for intensive care units, palliative care. And do you have any preference which is better, or you applied both three of them? And in Bangladesh, do you have any preference about the palliative care? This is important for ethical framework. Some of them will be better to ethical relationships and ethical care. I think that. And do you have any suggestion about it? Thank you.
Thank you for the question. Yes, in Bangladesh, hospitals are not following any specific ethical guidelines. Actually, it hasn't yet been established in Bangladesh. So first of all, I'm trying to interview some doctors, nurses, other healthcare professionals, so that I can provide a guideline, or I can encourage them to follow a guideline.
Okay. Yeah, thank you, and I think it's maybe
Thank you.
needed.
Yeah, thank you.
Other comments or questions? And thank you, Mina, for sharing the paper.
Thank you. No problem.
Okay, Tahira, go ahead.
It's a very, may I continue?
Please, yeah.
Yeah, it's a very good presentation. Thanks. And the questions about Bangladesh are also quite relevant, because the presentation is general guidelines which should be followed wherever there are patients who need palliative care. But in resource poor settings, many different options are given, and in countries like you said, in Japan or USA or Sweden, the palliative care is at much higher standard. Quality of care is good, and the patient suffers as less as possible. But in public facilities in Bangladesh, it's very difficult to get this sort of treatment, because they are not ready for it, mainly because of the load of patients. It's in Dhaka Medical College every day, 1,200 patients get admitted, and they all on the floors and this and that. So maybe we can think of a different model, but what usually happens is when a doctor and the family recognizes that the patient is at the end of their life and there is no cure, then usually, especially in the village settings, the family takes them back to the village. There's some medications so that the pain is relieved, and there's someone, the family takes care of them. Whereas in private, sophisticated hospitals, a lot of care is taken. The patient usually stays as long as that person lives, and then sometimes when they go to coma, they are also given the lifestyle support, which sometimes is not wanted, but yet almost enforced by these private hospitals. So as Nusrat said, there should be clear guidelines, especially on what should be the best option for the patient, not for the hospital, not for the doctors, but for the patient. And also, the case of euthanasia in Bangladesh is very controversial. I don't think up till now very few, if at all, patients would ask for euthanasia, because according to our religion, Islam, it is forbidden. So, though the person will be suffering, she or he and the family will prefer to take medicines or painkillers or whatever boundary so that the pain is not there, and we try to make that person as comfortable as possible. So I think it's a very good focused presentation. A few examples of different countries, like in Asia and in first world, second world, third world, then we could see the differences. And culture plays a huge background into this. Thank you, sir. Thank you for giving me the program.
Thank you so much. Yes, I'm trying to explore the current practices. Also, I'm interviewing in UK and other countries to know about these guidelines. So thank you so much for your solutions.
Are there any other comments or questions? Okay, yes, so thank you very much, Nusrat.